Okay. All right, everyone. Welcome. This is being recorded, by the way, so that we can share it later on in case there was something you missed, or even for our friends that can't be on live with us today. So my name is Catherine Farfan-Selim. For those of you that may have forgotten my whole entire name, but yes, I am your fitness coach in person, virtually, and of course in our Facebook group, the Dance Fit Hub. Welcome everyone to this special Menopause Awareness Month event. October was so packed with so many awarenesses, but I didn't want this one to, kind of fall off on the side, right? So this is actually the first time that we are doing a menopause awareness month event. We've had previously other guests come on to talk about menopause, but none such as this wonderful guest that we have tonight. So I am so thrilled to be joined by nurse practitioner Tamara Alicea Nieves. I love that name. But before we begin, I do want to mention that we have a quick giveaway tonight. And so, five women who attend today live, which are those of you that are here, will win a copy of Hormone Havoc. Which Tamara will tell you a little bit about, but it's by Dr. Terry. I call her Dr. Terry. And it's a really, really fantastic book that kind of talks about the myths about hormones. And it really empowers women with knowledge, true knowledge, not just like all that loudness of the internet. So that's what I really, really love. So make sure that you stay tuned until the end for your chance to win. All right, so let me tell you a little bit about our special guest. Now, our guest I only met maybe a month ago, maybe. And I was like so
Woo!
happy when I met her because I was like, yes, this lady gets it. She understands what's going on. But Tamara grew up in Puerto Rico and began her career in a unique way, working with dolphins at SeaWorld, which I'm like unique and cool, right? I mean, who doesn't want to work with dolphins? But that's where she developed a deep appreciation for science and care. And she later made a passionate transition to nursing, spending many years in emergency rooms across various settings, gaining, of course, invaluable experience in acute and critical care. Now, today, she focuses on helping women understand their health, women like you, understanding your health, balancing your hormones, and feeling your very best at every stage of life, which, hello, that's what I talk about all the time. So that's why I clicked with her. She's currently the co-owner of Rejuvenate Wellness Center in Hunters Creek, Florida, which is, I guess, in the Kissimmee vicinity, if you want to think of it that way. And Tamara, could you share a little more about your journey and what inspired you to specialize in women's hormone health?
Sure. Thank you, everyone. Thank you for having me. It's a pleasure to be here and be able to help and empower women, especially in these transitions that we kind of go through. So, what empowered me was in the hospital, as well as when I journeyed into primary care. It's just the lack of awareness and the lack of empathy that I find my colleagues that are fellow nurse practitioners and physicians that they have with women. So it's like I hear all the time, it's like, a man will go into the doctor's office and say, hey, I'm having X, Y, and Z problems, with their issues, male issues. Oh, let's start you on this, and that. And let's do labs. Us women will go to our providers. Hey, I'm having difficulty sleeping. I can't concentrate. I don't want to have sex with my husband. I have painful sex. That's normal, deal with it. So I got very tired of listening to fellow women say that all the time. Like, nobody's listening to me. I don't feel like myself. So that kind of, when we started the wellness center, our goal at the Wellness Center is to empower people to prevent issues and chronic illnesses. And if we don't listen to women and kind of figure out, hey, let's try to figure why you feel the way you feel, we're not doing ourselves any justice. So I got kind of tired of listening to the same, to the point where it's one of us has to start a building block. And so that's why we do what we do.
I love that. I love that because that is so true. There's so many things that in the past, like our moms and their moms and their moms, right? These are all things that no one wanted to talk about. No one wanted to share, whether it was embarrassing or it was just like, you don't talk about those things, right? But yeah, it did take people like you and other women to say, no. Like, we need to start talking about this because if I'm having this issue, how many more women out there are having this issue, right? So let's get right down to this. Why is menopause such a critical stage for women's health in even in their 50s and in their 60s?
So it is a really big misconception that women in their 50s, 60s, or postmenopausal or during menopause, that that's normal and there's no hormone therapy or nothing to be done. There's different modalities, but it's like all those changes that are going in our bodies lead to other chronic medical conditions. The leading cause of death for women is heart disease, and low testosterone levels and menopausal changes lead to heart disease. So it's like when we're in our 30s, 40s, and 50s, we have to be preventive, be aware of our hormones. And when we go into our 40s, 50s, it's not too late to either replace them or work with them if you don't want replacement, but kind of know what's going on and how do I prevent it from getting worse so that I don't go into osteoporosis or heart disease, obesity, visceral fat gain, which is all a result of menopause. I'm more tired, I'm more fatigued. So if I used to be able to walk a mile, now I can barely run a quarter of a mile, and that will lead to other chronic illnesses. So it doesn't matter if we're 40, 50, 60, 70, 80, we are still okay to have some sort of hormonal replacement or some sort of relief. So it's very important because if we don't take care of our hormones or what's going on, we can't prevent chronic illnesses. Hormone replacement is super crucial in preventing diseases like dementia, which is affects women more than men, because men get testosterone replacement where women it's a taboo. Like, no, you cannot. Like 10 years after menopause, you're supposedly not eligible. So now we're doing more studies that show that no, it doesn't matter if you're 10 years, 20 years post menopause, you're still okay to get hormone replacement.
Yeah, and that's really ladies that are, I hope that you're listening to this because what Tamara is telling you is that any thoughts, any beliefs that you had prior to today about menopause, like take your pencil and erase them because that doesn't exist anymore. We're living in a time right now that menopause has now come back, it has resurfaced, and so many women like Tamara are making, more research and they're finding out that a lot of these symptoms, right, like the ones that she mentioned, are not symptoms of necessarily aging, right? Like we've been told for so many years, like, oh, you're tired because you're getting older. Oh, you don't want to have sex anymore because you're old. Like that's just happening. No. There are very common symptoms now that have been linked directly to menopause, even after not having your period for a long time. So it's not just that because, and I mentioned that because a lot of ladies, when I mentioned that we were doing this tomorrow, they were like, oh, I lost, my period was like, it's been gone for so long. And I'm like, yeah, that's not what we're talking about tonight. So, so tell me a little bit more about hormone therapy. So I know that you said a little bit about the benefits, but how does it help women currently experiencing menopause? And then if you would go into like the types of hormone therapy that exists.
So the way that we have to look at hormone replacement is the way that we look at, like when we get older, our teeth decay or our teeth fall, and we tend to replace that. So we fix our teeth. If our heart valves go bad, like we go to the cardiologist and they replace the heart valves. So, our ovaries are what produce hormones. So our ovaries get old, they start producing testosterone, they start producing estrogen and progesterone, but we say, oh, that's okay, that's normal, and we don't try to fix it, which is a mistake. And that is where hormone replacement comes in. So there are different modalities, but if we look at it, testosterone is in men and women. It's like the gasoline of our cells and our bodies. So that is what our bodies need to function. So if you have no gas, you're not really going to get down the street or anywhere because you can't go anywhere. And so the majority of the symptoms you feel with hormone, imbalances with low hormones is the fatigue, the tiredness, the mental fog, like you just don't feel like yourself. And no, that's not part of aging. That's not part of stress. Most of us have had no changes in our life within the last 20 years. You still have your kids, you still have your household, you still have a job. You're looking to, if you're past 50, God bless you, because you're almost about to retire and you worked so hard for that to only feel tired. And that's not normal. It's not what it should be. And that's where the hormones come in. But the key hormone is testosterone because that's your gasoline. And we tend to associate it with all these negative cognitions, like I'm gonna get a beard, I'm gonna change my voice, like I'm gonna turn into a man. And it's all the misconceptions of those high doses. So as women and in my job, I'm not trying to make y'all into bodybuilders. I'm just trying for you guys to feel normal. So the leading right now doses of hormone replacement in women is about 70 milligrams a week. And that's at a really high dose. Usually you start at about 25 milligrams and you feel great. Like you feel back to yourself, everything just goes back to normal. And I think most women have that little belly flap that you can't explain. And no matter how hard you work out, it never goes.
Right.
That's where testosterone comes in. I call it the testosterone belly. Um, I gave it that name after my mom because I saw my mom's body just transform. And I was just like, Mom. And so we checked her testosterone levels. She was very hesitant to do therapy until she started at a low dose, and her half her belly's gone. And my mom is 68.
Wow.
So, yeah. And so hormones play a very big role in just preventing osteoporosis, preventing osteopenia, preventing heart disease, and not at high doses. So you're not going to grow beard. You're not going to turn into a man. You're just going to feel better. The estrogens also help a lot of vaginal dryness. And you might not want to have sex, not because you don't have the urge, but because you're dry and it hurts and it sucks. And topical vaginal estrogen actually is non-absorbed systemic. It helps, it prevents UTIs at a certain age. So I always recommend it to everyone because you don't want to die of a UTI that could have been prevented.
Yeah.
So little things like that. The progesterone is in pill, but it also helps regulate everything else. So they do a great combination, but everybody's different. So it's a matter of what do you need? Because you might need testosterone, but not estrogen, because everybody's ovaries are different. But it's super crucial to just prevention of chronic illnesses. And those chronic illnesses will lead to death, which is preventable.
Yeah. So is it like pills? Is it patches, creams? Like what are the differences between those?
So there's a whole bunch of different modalities and different things that we can use to replace hormones. You're not set in stone. So if your provider tells you, oh, once you start this, you have to stick to that, they're lying to you. So you have pills for estrogen as well as progesterone. You have patches for estrogen and testosterone. The testosterone is a little bit hard to come by, but it's available. You have injections and you have also pellets. The pellets are a new conundrum because they're kind of new in the market.
Mhm.
And if you guys listen to anything, this book by Dr. Terry Dinelli is amazing. She's also a nurse practitioner, and she is one of the founders of Avexius, which is a pellet company. And she developed her own pellets based on her own frustrations going through menopause. And so she's a strong advocate for pellets, but it doesn't have to be for you. So if you're not comfortable, you have so many other modalities to pick from.
Yeah, I was speaking to someone the other day, and that's when I sent you the message about if the center provides the pellets, because she said
Mhm.
she's been using those for years, and she's a snowbird, so she's here, in Florida, and she said she only gets it back home, and she hasn't found a place down here. And she's like, I would love it if
Oh
I
yeah.
could do that, and I said, I have a place for you. But yeah, so it's again, it's people not talking about it. So like how would she ever have known? If I would have never, had this conversation about it, she would have never known. Now, let's talk about possible risks or side effects because most of the ladies that are on here, I would say are in their 60s and 70s. So they're probably like, let's hear about those side effects,
Of
ladies.
course, yeah.
Turn
So,
your sublime.
yeah, I'm sorry.
Nope, that somebody's unmuted. That's
Oh,
okay.
okay. So, everything comes with a risk.
Oh, sorry. I muted you by mistake. Sorry.
Yeah. All right. So everything comes with risks. Some of the side effects that can cause if they're not managing testosterone correctly, and you go from a very low dose to a very high dose very quickly, hair can fall out, the voice can change, the clitoris can grow a little bit. That one goes back to normal the minute that you stop taking testosterone. The voice changes, not so much, but and hair growth specifically. So those are risks of, overdosing with testosterone. So that is why it's better to start slow and steady and kind of build that testosterone up. And I have a lot of my clients that they start feeling good with the testosterone. I want more, I want more, I want more. Like, no, we're not men. We're not going to do 150. No, we're going to stay at 25 and kind of, go grow it up so that your hair doesn't fall off and you don't grow a beard and, all these weird things. With estrogen, there is a little bit more of a risk, especially as we age. And that happens no matter if you're on birth control pills, women after 30s, in their 30s that smoke. Estrogens can cause blood clots, especially injectable estrogens and pills. So, with certain age groups, if that is a concern, family history, I recommend vaginal or transdermal estrogen or the patches because they're absorbed locally, especially vaginal estrogen. It does not absorb systemically, so the risk of blood clots, of if you have a history of breast cancer, it will not absorb to the rest of the body. So it is very safe to use vaginally or topically. With progesterone, and Dr. Terry talks about it very clearly. For a long time, we had this. I guess confusion because we thought progesterone was the same thing as progesterone, and it wasn't. So, one of my employees, a staff member, she developed breast cancer because she was on progesterone. She very early on in her 30s, she had a hysterectomy. They put her on the progesterone. She developed breast cancer. Now she takes her progesterone very safely. Her oncologist approved it at a low dose, but she is on hormone replacement and she feels great. But it's those misconceptions that we kind of put it all together that have led to fear, which is understandable. But progesterone is completely safe, and we just have to make sure that when you're getting the prescriptions, no progesterones.
Right. That's why it's important when you go to these types of centers. I know some of you have gone to like, I'm gonna call them I don't know what kind of centers they are, but like they offer weight loss shots and, skin tightening and things like that. And they are offering you, let's say, something like this, right? A lot of you aren't completely honest about all of the medications that you're on and the procedures that you've had, and so on and so forth. And so it's extremely important for you to be open and honest with, wherever you go, not only to like to Tamara, but if you go anywhere, to be honest about what you're taking, because you might think one thing has nothing to do with the other, but I mean, you see, with the one client that she's saying, with the breast cancer, right? If they were giving her one thing a long time ago and it was giving her a different, a different result is what happens. So you definitely want to be open and honest about what you're taking or what you have taken, because those items also have side effects. So everything, there, I don't think that there's anything out there that isn't going to have, fine print. There's always there's always fine print. So specifically for women, let's say they've gone through the menopause and but they're still like, I have to sit under a fan. My joints hurt. I'm hot, then I'm cold, then I feel like I keep forgetting things a lot. Um, is hormone therapy right for them?
Absolutely. So it is a big misconception. And I also recommend another book that I feel all of you need to get. I love her. It's by Kelly Casperson, and it's called The Menopause Moment. So, oh, there we go. There we go. I don't know if you can see it, but it's called The Menopause Moment. I'll send Kathleen the link. It talks about exactly that, on how, for some reason, women post menopause feel that they cannot get any help and that there's no relief. So that's not true. Like, you can get relief. If you are stressed about, hey, I'm not sure if I want to do my estrogen, that's perfectly fine. And it's perfectly safe to take testosterone in any modality. My personal favorite is the pellets because it gives you a smooth continuum. But if this is something new, which it is, let's start with injections. Let's start with the creams and see how you feel. And then we evolve to a different modality. And like I said, vaginal estrogen is completely safe and alleviates a lot of the symptoms. But for those women that are like, you know what, like that's great, but I don't know if I want to jump into the hormonal bandwagon, like I say. I have found on my clients, because my clients are the ones that teach me the most. Injectable CoQ10 is amazing to relieve the symptoms of hot flashes, cold flashes, and energy. It's a band-aid, so it doesn't solve, but it's better to get some relief than nothing.
Mhm.
So for those of you that, hey, I'm not sure about hormones, I still need to kind of brush, get more info. CoQ10 injectable is amazing. Some women get relief from 1 week to 1 month with just one injection. So it's something for you guys to definitely try.
Now, is there anyone that hormone therapy is not recommended for?
So, with the estrogens, estrogen in particular, there are breast cancers that feed off of estrogen. So, if those women know that, hey, I have an estrogen dependent cancer or history of, obviously, we wouldn't want to give estrogen at all. And it's not that the estrogen will cause the cancer, but it's like it feeds off of it. So we're feeding those cells to eventually, if there's anything left that is just dormant, it might come back to life, and that's an unnecessary risk. But
Mhm.
testosterone is perfectly safe to use because it doesn't feed that. And the same goes with men. Like, there's men that suffer from prostate cancer that is fed by testosterone, and those are unfortunately, we have to take away testosterone and suppress it. So the only risk is breast cancer that is estrogen dependent.
Okay. So let's say you have, some ladies that are on here and they're like, that's great. Um, but I don't want to do hormone therapy. Like, are there any other ways to feel better without having to do hormone therapy?
Like I mentioned, you have the CoQ10s. I tell everybody, every patient of mine, male, female, young, old, I put them on prenatal vitamins. I say this in every consult. I wish they would change the name, but prenatal vitamins
Because
are the
right now you just probably had a few people go,
what?
yes.
We're used to those, like the 50 plus and that this and that, but when you compare them to prenatal vitamins, the prenatal vitamin is still the most complete one and has the highest ingredients of every possible vitamin. So I don't see why we stop that after we have kids, because it's just a deterrent. So when you start taking the prenatal vitamins, you're going to notice more energy, better hair, better skin, overall just feeling a little bit better. better. I haven't heard, so if this happens to one of y'all, please share that it helps with hot flashes. But it does help boost the energy. There are some vitamins and some ingredients that will help support the testosterone that you do currently have, that your ovaries produce. And it's the combination of vitamin D, zinc, and magnesium. So those are alternatives that you guys can do. You can do injectables, you can do pill forms, take a walk, whatever modality you feel comfortable with, and that will help sustain your hormones. So a lot of the times, my patients will be like, hey, I did the hormone, but I don't want to keep doing it. What do we do? So we do the prenatal vitamins with the combination of these three, which is vitamin D, zinc, and magnesium, injectable, and they hold pretty well. And
Okay.
I always have the CoQ10 because the CoQ10 is what helps with energy and the hot flashes.
Okay. So if you can give one piece of advice to women navigating either pre or in menopause or post menopause, what would it be?
So don't stop exercising. Like that is the key to
Wait a minute.
prevention.
Wait a minute. Can you please repeat that? Because I don't think I heard that correctly.
So exercise and that's the biggest component, but that's the best way to maintain and produce hormones. Like your body will want to stimulate it. So whatever you guys do, do not stop working out and take your multivitamins, prenatal ones. If you don't want to do anything else, that is the key to just longevity and the prevention of osteoporosis, heart disease, obesity, and all these things that come with menopause. Also, keep in mind that when you guys join a group like a gym, a cycling, online, we support each other. So, hey, I'm having a hot flash today. I get it, but let's go work out. So, we motivate each other. And that's the most important piece that when we're in situations like this and we're not feeling our best, hey, I get it, but let's keep going so you feel better in the morning. So, that is the biggest piece I can take. Just keep exercising, keep on your groups, and just keep supporting each other.
Now, how can people connect with you or learn more about this and the services that you provide?
So, I can share the clinic phone number as well as our email, and our Instagram. You guys can reach out at any point in time. I will answer. I do better with texting. So when you guys text the clinic number, it's usually myself and my colleague Mark that will answer. Most hormone related questions I will answer, especially with women because it's like my cup of tea. So we're always accessible. You guys can stop by the clinic just to chit chat. I mean, chit chatting with us doesn't cost a thing. We're here to help the community. We'll do FaceTimes, whatever you guys are comfortable with, but it's just we're here to try to help each other and support each other to grow and learn.
So I was going to mention that they do virtual consults. So for those of you that are like, "Well, I don't live in Florida, like that doesn't work for me." Well, they can do a virtual consult with you, right?
Yes, definitely. It's also important to remember that, as a provider, I deal with a lot of non-PCP patients now. And so my job is also to counsel so that when you go to your doctor, you know what to say and what to ask for. It's difficult, and I know some of my colleagues are not open, they don't like to listen, or they just don't want to deal with it. But I tell all my patients, like, this isn't free. You guys, you come to me and you pay to see me, you pay to see your doctors. So you have the right to get good care and good service. And if you don't like what they're saying, well, ask again because it's y'all's right to do that.
That's right. That is something that I've
Mhm.
always said to all of my clients, um, if you don't understand why you're taking a medication, you need to find out why you're taking it, right? You should understand.
Mhm.
And I mean this in the nicest way, but doctors and nurses talk in like doctor language a lot, right? And so most of the time I'm like, no, 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 I don't understand what you're saying. Can you just please explain it to me? And it's okay for you to do that. You're already paying to be
Correct.
there, to sit in that seat. And he may or she may want to leave in 5 minutes because they come in and they're like,
Correct.
oh, you're good, and then leave. But that's your time as well. So yeah, she's totally right in saying like ask, find out why do I have, what am I taking? Why am I taking it? If I
Or
take this, is there, what are
yeah.
the what are the things I should be concerned about? Because sometimes I also think that doctors don't necessarily know everything that's out there now for menopause, especially
Correct.
male doctors. So, I know we go to the doctor thinking, that they are the end all be all of everything, but sometimes, it's new research or new findings, and so they may not necessarily know, and it may not be their thing. They may
Mhm.
be more into heart, health or whatever it is. So always ask about that. Now, for our locals, I know you're hosting a special event soon. So can you tell us a little bit about that?
Yes, so in the area of like South Orlando is what I like to call it. It's South Orlando, Kissimmee, Poinciana, St. Cloud. The new thing in Orlando is all these social and wellness events. And we noticed, especially me being Hispanic, that there is no such thing in the Kissimmee area or, in South Orlando, the southern parts. So we decided to host a free wellness event where people come and they can enjoy free Zumba classes, free yoga classes in the morning, circuit trainings to meet some of the personal trainers that we collaborate with in our clinic, get your biometric screenings, your body compositions, talk to our nutritionist, and just get an idea of why it's important to have appropriate nutrition, especially in menopause. Like, nutrition plays a huge part in helping us feel better. So we decided to host this free event. It's October 26th. It is from 9 o'clock in the morning to 1 p.m. And you guys are welcome to come. We have vendors supporting the local, vendor community of small businesses. Mostly are women, Hispanic women. As it's personal to me. It's really hard as a woman to own your business, to run it, and be successful because we have so many other jobs to do too, like being a mom, carry the household. In addition to, so we support a lot of our local business owners, and the majority of those coming are women. So it'll be very, very exciting if you guys can participate, and it's free. If you have little kids, we're going to be doing a little trick or treat so they can wear costumes and collect candy at every of the vendors.
Mhm. And the reason why I am inviting everyone to go, because I will be there. But um Rejuvenate Wellness Center is the name of the facility. And they do hormone therapy, but they do so many other things. And every service that they provide is literally about rejuvenation.
Mhm.
And that's what I really, really loved. I mean, they do everything there. I mean, from like your face, things with your face, with your skin, with your body. And then they also have like estheticians that do, kind of your regular spa services, that what you would consider regular spa services. So it's really a whole wellness center. Um,
Mhm.
and everyone there is super, super kind, and it smells so good. I'm so there. I don't know. I literally, when I was there, I'm like, do they put something in the vents? And the front desk girl was like, no, it's this. Pointed
Yeah.
to the freshener. And I was like, oh my God, it smells so good in here. I kept telling my daughter that. But
Yeah.
very welcoming staff. And I've already sent a few of my clients there because they've provided me with a lot of relief in a lot of different places. So
Yeah.
I am so happy that somehow, the universe brought us all together.
Mhm.
And now I'm sharing that with you. So if any of this resonated with you, or if there's anything else, because I will have Tamara back to talk about something else that they do, peptides, right? Which is helping me tremendously. So that'll be another day. But today we're still on menopause. So thank you so much to Tamara. Everybody give her a round of applause. Thank you so
Thank
much
you.
for her professional guidance, right? And as a woman guiding you through it so she gets it. And her wisdom, right? Because this is what I love the most. Speaking to professionals that actually are living and breathing what they're trying to help people with, right? And you hear it in her voice. I mean, she wouldn't try something like this with her mom if she didn't think it was something,
Correct.
you know,
Mhm.
safe and something that would benefit her mom. So I encourage you to really look into it if this is something that maybe you're like, maybe I need this. But I do want to open up the floor to see if anyone has any questions. So if you have any questions, you can unmute and we can get those questions going. If nobody has a question, that means Tamara is excellent. An
I don't have a
excellent.
question. I just want to say thank you. That was a very nice presentation. I really enjoyed it.
Thank
And
you.
can you tell me again, it's Rejuvenate. What is the name?
Rejuvenate Wellness Center.
Wellness. Okay. Okay.
Yes.
And
And
that's where the 26th is right there at that one?
Yes, so it'll
Okay.
be in the plaza. It's out of Town Loop Boulevard. So we're right off of Town Center and John Young Parkway. So it's a big medical plaza across. I don't know how many of you are familiar with Hunters Creek area, but it's right across from the Burger King. So it's right there, Town Loop Boulevard and John Young Parkway. So we'll be right there. There'll be balloons, there'll be everything. So and we can send I can send the little flyer to Kathleen and she can forward it to you guys.
Mhm. Yes, I'll be
Good.
sharing.
Thank you.
I'll be
You're welcome.
sharing more information on that event, probably in the next few days in the group and also via email so that everybody has that. Any other questions? Marva, go ahead.
Yes. My question is about the treatment of women who've experienced surgical menopause,
Mhm.
meaning that there's no ovaries.
Okay.
So, how is the treatment for those women different than a woman who has ovaries?
So the key point to this is not your ovaries obviously are the ones that produce the hormones. So the main difference is doing the lab work and see where the levels are. So where depending on where the levels are, it will determine the dosage of the different hormones. So progesterone is pretty basic, but then the testosterones and the estrogens will be like the determining factor of how much. But the treatment is pretty much the same. It's just the dosages will be different until you reach that plateau of, hey, this is what my body needs and this is what's like optimal for me. So that is the main difference. But we would treat it the same. The main, determinant also is your age. So depending on age, I might be a little bit cautious about using patches of estrogen versus pellets or creams.
Okay, thank you.
You're welcome.
Bev, did you have a question?
I do.
Mhm.
Um, is any of that like lab work or the medication covered by your, in this case, Medicare and Medicare supplements
Absolutely.
insurance?
Yes, absolutely. So, a lot of the providers don't take the time, and I think this was my biggest frustration with my colleagues. If you code it correctly, which is postmenopausal, Medicare will cover all your lab work, and you shouldn't have to pay anything out of pocket. The injectable testosterone is covered by insurance, as well as the vaginal estrogens. So that is completely covered by insurance. Unfortunately, like the topical testosterone, which is what my fellow colleagues are now fighting with the FDA, are not covered and they're very expensive. But at our wellness center, we work hard. So we collaborate with different compounding pharmacies to make it affordable. Right now, they're about $400 or $500, which is absurd and crazy. So we try to make the creams affordable for under $100 for the patients.
And the secondary follow-up question is the injectables, is that self-injecting like GLP-1 type things, or is that something you go to the clinic for? What, what's that?
So the injectables, that depends on you. So they are intramuscular. So some people can inject in the muscle. You can do it in the thigh, which is a little bit easier than the gluteus, or you can have someone that helps you. We understand that not everybody wants to do that. So some of our clients come weekly to get the injections, or they find a friend or a family member that can inject them. So it's it's a very personal journey.
Okay.
So if you feel comfortable, you can do it. We definitely teach you. And if you have a friend or if you want to come to the clinic, you can. There's no additional cost for that.
Thank you.
You're welcome.
Okay, anybody else? Let's see. Nobody else? Okay. All right. Well, if no one else has any questions, again, I want to thank Tamara for joining us. I know she gets home really late, so I'm very happy that she was able to do this. But remember that 5 lucky attendees will win a copy of that wonderful book that she mentioned, Hormone Havoc, to help you on your journey. And the winners will be contacted after this evening's event. So be sure to join us next Thursday. Don't forget, next Thursday we have another special guest for our breast cancer awareness event. And that special guest is Melissa Rosas Jimenez. So keep an eye out for all of that information. And again, thank you to all of you who came on. I'm just going to ask you not to leave because I want to confirm everyone's name so that when we do the drawing, we have everyone included. But Tamara, again, thank you so much. It was so great and I learned a lot. So now you have me coming in for something else. All
Pleasure. Thank you guys for having me.
right, good night.
Thank you.
Thank you.